If a person is diagnosed with osteoporosis, generally the recommendation is to treat any underlying condition that might be contributing to that person's bone loss. In people with poor diets, it's recommended to improve the diet quality. This is not just in terms of calcium and vitamin D intake, but also in terms of protein intake, making sure the person gets enough of the right nutrients to maintain skeletal health. Once those issues are addressed, then certain social habits should be looked at. If the person is smoking cigarettes, drinking too much alcohol, or taking too much caffeine-containing beverage each day, those issues should also be addressed. And in general, it's said that women or men who smoke cigarettes should discontinue completely, not just for osteoporosis, but for other health reasons. If a person chooses to drink alcohol, 1 glass of wine or beer per day or less is currently thought to be safe for the skeleton for women, and 2 glasses per day for men. In terms of caffeine-containing beverages, 3 cups a day or less of any caffeine-containing beverage should not hurt the skeleton, but if the person chooses not to drink caffeine for this or other reasons, this will not hurt the skeleton. So between dietary sources, avoidance of certain lifestyle habits that might hurt the bones, maintaining good nutrition, and specifically maintaining good calcium and vitamin D intake, and then maintaining regular weight-bearing exercise, not just for your heart, but also for the skeleton, these things will lead to preservation of bone density as a person gets older and reduce the risk of subsequent osteoporotic fractures. Good nutrition, and specifically maintaining good calcium and vitamin D intake, and then maintaining regular weight-bearing exercise, not just for your heart, but also for the skeleton, these things will lead to preservation of bone density as a person gets older and reduce the risk of subsequent osteoporotic fractures.